So my name is Dr. Richard Olunga. I'm a senior medical officer and I'm also the clinical manager of Bama Hospital in Siaya.
So you recently had an experience at delivering a child where a woman had the postpartum, a serious postpartum hemorrhage, and you used the UBT.
Yes.
Can you just tell us the story of what took place in the delivery and how that happened?
Sure. So this lady, 34-year-old lady, para 3+0, who came to us for delivery, she was in labor, but at some point the labor arrested, so she wasn't getting good contractions, so we were forced to augment it in second stage, so when in the active phase. So after the augmenting, she went ahead to deliver comfortably, but immediately after the delivery, within like 10-15 minutes, when the placenta was delivered, she started pouring, just developed a very bad PPH. So she was pouring and pouring. We did everything that's conventional. We ensured the bladder was empty. We did uterine massage. We gave all the oxytocins, nothing. Unfortunately, there was no blood to transfuse her. So basically what we were relying on at that point was just to give fluids and to do all the other conventions that we know. Then at some point, it even didn't come, the idea didn't come from me, but rather from my nursing officer in charge. You said, we've been trained by KMET on this issue of UBT. Let's give it a try, just to see, because the lady was pouring, literally pouring blood, you know. And she was already turning pale, she was confused, she was in shock. The pressure had already gone down at around 80, 50. At some point, we couldn't even detect the pressure, and the pulse was quite high. She'd already developed tachycardia, trying to compensate for the acute blood loss. So basically what we did, we tried the UBT technique. And you know, it was like a desperate measure, because at some point we knew we were losing the mother. Yeah, everyone knew that we were going to lose the mother. So we put in the balloon, just the way we'd been shown by KMET. We inflated it with around 60 cc of water. Then we put in, you know, the balloon to hold it back from coming out. Then it worked like a miracle. All the PPH stopped at once, just stopped once. We're all shocked, because you know, we'd really tried many conventional things, but it stopped at once, and you know, everyone was excited. And now we started looking for blood. We never found blood. We called the nearby institutions. There was no blood. So we pressed in with the fluids, but now, because the bleeding had stopped, with our fluids going on and the bleeding had stopped, the lady who had already collapsed at this time, was already semi-conscious, wasn't communicating, wasn't taking command, started coming back and asking us. She was saying, I was feeling thirsty and I was feeling like I was dying. I felt like I was dying and I was feeling quite thirsty. You know, and she came back. So after she was stable, that is when we contacted our coordinator, that lady, and asked her, now, you taught us this thing, we've done it, it's worked, it's a miracle, it's worked well, it saved a life. But now, when do we remove the balloon? You know, then she told us, you can keep it as 12, 24 hours, it's okay. So we kept it in, and after around 12 hours, it was removed. The lady was stable, and absolutely no complication after the UBT. It was a successful story.
And so, which is a miracle story, really. It's, the way you tell it's really exciting. Yeah. So I just want you to establish, please, the reason people thought this, when you were really interested to tell a story, is, can you just describe, did you have skepticism when they first presented this at the training?
Sure. At the first time when they came, I'm the only medical officer in that institution. So, you know, I had KMET coming to train, you know, nurses and clinicians on the same. So I thought, I asked for training on what, and they told me on PPH. I said that this thing I trained in campus for 6 years. PPH, I know everything conventional about it. I know the drugs to use. I know to uterine massage. Basically, I'm okay with it. So, you know, I didn't really have interest in it because I thought, I mean, I've managed PPH before. And like this particular lady, you know, I thought of taking her to theater. Why I say UBT has a big advantage in this particular case is because I thought of taking her to theater and do maybe just a TH, get the uterus out to achieve that hemostasis. Then the anesthetist said, I'll not take such a patient to theater without blood. And there was no blood, you know. So I had this skepticism before because I knew that I could handle, if push comes to shove, then I'll go in and get the uterus out and achieve my hemostasis. But this is a case scenario whereby even in theater you can't go because there's no blood. Yeah, you know, there was no blood in the country. Basically in the country there was no blood at that particular time. The only option was UBT. So I came back and told my nursing officer in charge, hey, I had kept him in the training, but I think this is the thing. Now I can champion for it because it has worked for me, a miracle that nothing else would have worked for me. So I champion for it now.